Hi, Mr. and Mrs. Smith. It's so nice to finally meet you guys.
Hi, you too.
What brings you guys in today?
We were just concerned because we're about to have our first child, and we're not sure if they are going to have sickle cell anemia because the condition runs in our family. So we just wanted more information.
Yeah, sure. I'm really glad you guys decided to come in. So what are some of your initial thoughts and concerns?
Initially, we were just wondering if there's a test that can be done so we can find out if our child will be affected with the disease.
Yeah, so it's actually a blood test.
Okay.
You can test for hemoglobin S, which is the abnormal form of hemoglobin found in individuals with sickle cell disease.
Okay.
Do you guys have any prior knowledge about sickle cell disease at all?
My mom actually hadn't, and she was always really tired, but she passed away when I was younger, so I didn't really get to know her that well.
Okay, so sickle cell disease affects 100,000 Americans in the United States, and what happens with sickle cell disease is that there is a single mutation in an individual's DNA at a particular location, and that causes the allele to be, abnormal. So with sickle cell disease, it's an autosomal recessive disease, so you need 2 abnormal copies in order to have the disease. So if you just have 1 abnormal copy, then that makes you a carrier. So you won't typically show the disease, but you may have the chance to pass on the disease.
Okay.
So do you guys mind telling me a little bit more about your family history?
My younger brother suffered from sickle cell, but both of my parents were perfectly healthy.
And the only person in my family that had sickle cell was my mom, and my 2 older sisters and my father are both healthy.
Okay. So you did give me some of this information before, so I was actually able to create a family pedigree.
Okay.
So you did say that your brother has sickle cell.
That's correct, yes.
And then you said that your mother passed away from sickle
Yes.
cell. So that would make you guys both carriers.
Okay.
So what does this mean for your child? So your child has a 25% chance of being completely healthy, both normal genes.
That's great.
And then there's a 50% chance that your child's a carrier for the disease. So they won't have the disease, but they have the ability to pass it on to their children.
Okay.
And then there's a 25% chance that your child will have sickle cell disease.
Okay.
So do you guys have any other questions about that information?
My wife and I really appreciate your support. We were just also wondering what we should expect if our child does have sickle cell.
Absolutely. So I'd be more than happy to help you guys better understand the disease and how it occurs and what to expect. So actually I can just call my colleague, and she's a physician assistant, and she can better explain more of the symptoms and what to kind of expect.
Okay, that'd be great.
Here she is now.
Hi, Mrs. and Mr. Smith. It's so
Hi,
nice to meet both
Hi,
of
nice
you.
to meet you too.
I just wanted to really quickly talk to you about the disease process and what this means for your child.
Okay.
Okay, so with this particular disease, the baby will not show any symptoms until about 5 or 6 months.
Okay.
If they are born with this disease, they won't show it. You won't know.
Okay.
However, some of the earliest signs you may see in your child would be swelling of the feet and the hands. And they might potentially have a yellowish pigmentation to their skin. As your child gets older, he may experience pain or really extreme fatigue, shortness of breath, and dizziness. He or she is also more prone to getting infections, which might cause further complications later on.
Okay. It's definitely good to know what physical symptoms will occur, but will there be any issues with our child as they develop further?
Yeah, you might notice that your child is developing a lot slower than other children his or her age, especially when it comes to puberty and sexual development.
With our child potentially having this decreased quality of life, does that mean that he or she will also have a different life expectancy?
Yeah, unfortunately, the life expectancy for someone with sickle cell disease is about 40 to 60 years old. However, to improve your child's quality of life with sickle cell, if he or she does have it, I would highly suggest monitoring their exercise, their sleeping habits, their food intake, and try and limit their exposure to secondhand smoke in the future.
Okay, definitely.
And if our child does have sickle cell, are there different resources or support groups that we could look into?
Yeah, there are a variety of resources out there for people and families who do have sickle cell disease. So the American Sickle Cell Anemia Association does have a website you can look into where they have different support groups you can look into, so you can find something near your area. And I know this is a very difficult conversation to have, but I just want you to know that we'll be here every step of the way for you and your child.
Thank you so much. This was so helpful from both of you. Thank you. And we definitely feel more ready for this baby now, and we'll give you a call before we have another meeting.
We're really glad to help you.
Thank you.
Decided to come in. What are your initial thoughts or concerns about this?
Yeah, so I was just wondering if there's any way for us to test to see if our baby...
I'm sorry, your stomach.
I know!
you guys have any knowledge about sickle cell disease at all?
Well, my mom actually had.
Damn it, guys.
What is wrong with you?
My stomach growled so loud. I didn't hear that any of the other times, but I heard it that
Water.
Poor Callie, just leave her stomach alone.
She started
It
laughing
was
first.
so
I
loud.
said,
It was
that's
so
why I
loud. You
started.
can probably hear it in the
Okay,
video.
I had it together, guys. So unfortunately, the life expectancy is about 40. I'm sorry.
Oh my God.
Guys, it's too.
Test. You can test for hemoglobin S, which is an abnormal. Which is an abnormal. Can you please be professional here?
I'm sorry.
This
I'm
physician
sorry.
assistant.
I know I'm new. I'm sorry.
I'm about to have a
putting
disease
everything
child.
on the line. You're laughing
I'm
about
putting
it.
everything on the line to get you here, and
I know.
you're just
I'm
being
really sorry.
disrespectful.
I just graduated. I'm sorry. Go ahead.
Do we trust these people?
Okay, well, anyways, as I was saying,
Yes, thank you so much. This was all really helpful, and we'll definitely give you a call before the baby is born.
absolutely.
Thank you.
Well, it's so nice to meet you.
Oh my god!
Oh my God!
Oh my God, your baby.